Lyme is called the great masquerader because it can look like almost anything. Chronic fatigue, fibromyalgia, lupus, rheumatoid arthritis, dementia, even Alzheimer's. This is why so many patients end up misdiagnosed and why they end up in my office after years of frustration. Hey friends, Dr. Fred Bloem here. If you're new to the channel, welcome. I help patients with complex chronic illnesses, especially Lyme, mold toxicity, chronic infections, hormone imbalances, and the mystery cases that haven't responded to anything else. If you find this kind of content helpful, hit subscribe, tap the bell, and join my newsletter so you never miss new updates. Today we're going to talk about Lyme disease, the quiet epidemic, and why so many people remain sick for years, and more importantly, what we can actually do about it. According to the Quiet Epidemic documentary, Lyme disease affects roughly 500,000 Americans each year, with 10 to 20% staying sick long term. That means up to 2 million people in the US are suffering from lingering symptoms. Lyme is called the great masquerader because it can look like almost anything. Chronic fatigue, fibromyalgia, lupus, rheumatoid arthritis, dementia, even Alzheimer's. This is why so many patients end up misdiagnosed and why they end up in my office after years of frustration. The documentary follows real patients like Julia Brazese, who suddenly lost her sight and mobility, yet conventional testing couldn't explain her symptoms at first. Her story isn't unusual. I see cases like this all the time. The film highlights something I talk about constantly. Standard Lyme testing is unreliable, especially later in the disease. Many patients fall through the cracks because early tests are negative, while symptoms continue or worsen. As Dr. Neil Spector said in the documentary, the burden should not be on sick people to prove they're sick. He was right. In my practice, I routinely find co-infections, toxins, hormonal imbalances, or immune dysregulation that were never tested for. And when you treat only one piece of the puzzle, patients stay sick. One of the biggest controversies the documentary addresses is this: can Lyme persist after standard antibiotics? Two major camps exist. 1. Lyme is easy to treat. A few weeks of antibiotics cures it. 2. Lyme can persist and requires a more comprehensive approach. The documentary highlights research from Dr. Ying Zhang at Johns Hopkins showing that standard antibiotics don't always eradicate Borrelia. Comparing it to mowing a dandelion, the top disappears, but the root remains and grows back. This supports what many of us in integrative medicine see every day. So yes, chronic Lyme is real, and patients deserve better than being dismissed. Most of my Lyme patients have been sick at least 5 to 10 years, have seen at least 5 to 7 specialists, had normal routine labs, were told it's stress, anxiety, hormones, or aging. Tried antibiotics but didn't get better. Never were tested for co-infections or mold exposure, were never evaluated for toxins, metals, or immune dysfunction. And many have 10 to 15 nails in the foot, as the documentary describes. Yet previous doctors only pulled out one nail and expected the pain to go away. Lyme is rarely just Lyme. This is where my root map pathway comes in. My comprehensive, step-by-step process for uncovering root causes. Number 1, advanced testing. Unlike conventional Lyme testing, I use specialty Lyme immunoblood panels. Bartonella, Babesia, mycoplasma, anaplasma testing, mold, mycotoxin testing, heavy metal testing, full hormone panels, immune system profiling, bioenergetic testing using autonomic response testing inspired by Dr. Klinghart's methods, genomic analysis when needed. When you test correctly, you finally get answers. Here's how I help patients who've been sick for years. Number 1, reduce toxic burden. Borrowing from Dr. Klinghart's biological approach, as mentioned in the documentary, I help patients lower EMF exposure, improve sleep physiology, detoxify heavy metals, break down biofilms, heal the gut and lymphatic drainage system. I use modalities such as detox protocols, binders, chlorella, zeolite, glycine, ion cleanse foot baths, photon wave detox program, ozone sauna and far infrared sauna, homeopathic detox support. I improve the patient's physiology by including the following treatment modalities: thyroid and adrenal support, bioidentical hormone balancing, electrolyte and mineral correction, intravenous infusions of other nutrients, whole food nutrition plans. Depending on the case, we use the following to target infections: herbal antimicrobials, including Boehner herbs, ozone therapy, MAH, Tenpas, Ibu, IV therapies, such as vitamin C, curcumin, artesunate, ALA, photodynamic therapy with a Weber needle endolaser, TrueDose IV PRP to modulate immunity, ozonated plant oils, rhizoles as noted in the documentary protocols, Curastrain, also known as SOT, supportive oligonucleotide therapy, peptide support, for example BPC 157, TB 500, thymosin alpha 1. To modulate and rebuild the immune system, I include treatment for mold-induced immune dysfunction, bioenergetic tools, light, frequency therapies, neural therapy. For musculoskeletal complaints, I use perineural injection therapy, PIT, for nerve pain, PRP and regenerative therapies for joint or tendon involvement. Lyme recovery isn't overnight, but with a personalized, layered plan and continuous adjustments, patients finally gain traction. Most tell me, I'm finally getting my life back. The documentary ends on a hopeful note, and so will I. Awareness is growing, testing is improving, research is finally catching up, and more importantly, patients are being heard. If you've been struggling, you do not have to stay sick. There is a path forward, and you don't have to walk it alone. If you'd like to work with me, you can schedule a route map consultation at the link below. Before you go, I'd love to hear from you. How long did it take for you to get a Lyme diagnosis? What symptoms have been the hardest for you to manage? What treatments help you the most or the least? Do you want a video breaking down co-infections like Bartonella or Babesia? Drop your answers in the comments. Your story may help someone else feel less alone. Thank you for watching. Stay encouraged, stay hopeful. Healing is possible.